Alzheimer's disease is a progressive neurodegenerative disorder that leads to memory loss, cognitive decline, and changes in behavior. The early signs of Alzheimer's disease can be subtle and often go unnoticed at first. However, early detection is important because it can help with planning, management, and treatment. Below are some of the key early signs of Alzheimer's disease, along with research references to provide more detail. 1. Memory loss. One of the most common early signs of Alzheimer's is memory loss, particularly difficulty remembering recent events or newly learned information. People might frequently forget conversations, appointments, or where they placed objects, and may become anxious about their memory problems. Research reference: a study published in JAMA Neurology discusses that one of the hallmark early signs of Alzheimer's is difficulty with short-term memory. The researchers noted that changes in the hippocampus, the region of the brain involved in memory, are often present in early Alzheimer's stages. 2. Difficulty with problem-solving and planning. People in the early stages may struggle with tasks that require planning, such as following a recipe or managing finances. They may also have difficulty solving simple problems that were once easy for them to handle. Research reference: according to a study published in The Lancet Neurology, difficulties with executive function, such as planning, problem-solving, and organizing, are among the first cognitive changes observed in people with Alzheimer's disease. 3. Disorientation and confusion with time or place. People may become disoriented in familiar environments, losing track of dates, seasons, or the passage of time. They may not recognize where they are or how they got there. In the early stages, this can be subtle, such as forgetting what time of day it is or becoming confused about the year. Research reference: a study published in Neuropsychology highlighted that disorientation in time and place is an early sign of Alzheimer's disease. This is attributed to damage in the brain regions involved in spatial and temporal processing, including the parietal lobe. 4. Trouble with language and communication. Difficulty in finding the right words, repeating oneself, or having trouble following or joining conversations are early signs of Alzheimer's disease. People may struggle with recalling names of familiar objects or individuals and may lose their ability to write or speak coherently. Research reference: a study published in Alzheimer's and Dementia, the Journal of the Alzheimer's Association, noted that early language difficulties, such as word-finding problems and impaired sentence structure, are often detected in the preclinical stages of Alzheimer's disease. 5. Impaired judgment and decision-making. Those in the early stages of Alzheimer's may begin to exhibit poor judgment, such as making uncharacteristic decisions related to finances or personal care. They may also become more susceptible to scams or engage in risky behaviors they previously would have avoided. Research reference: research in current Alzheimer research emphasizes that poor judgment and decision-making are significant early signs of Alzheimer's disease. This is due to the dysfunction in the prefrontal cortex, which plays a role in cognitive control and decision-making. 6. Difficulty with visual and spatial perception. Changes in visual and spatial processing can make it hard for individuals with Alzheimer's to recognize objects, judge distance, or perceive depth. This can lead to difficulties with activities such as driving or navigating familiar environments. Research reference: a study published in Brain explains that Alzheimer's often impacts the parietal and occipital lobes, leading to early difficulties in spatial and visual processing. 7. Withdrawal from social activities and work. As cognitive abilities decline, individuals may begin to withdraw from social activities, hobbies, or work. They might feel embarrassed or frustrated by their memory problems or cognitive decline, leading them to isolate themselves. Research reference: in a study published in Journal of Alzheimer's Disease, researchers found that individuals in the early stages of Alzheimer's often exhibit withdrawal from social engagement and interests due to the cognitive difficulties they face. 8. Mood and personality changes. People with Alzheimer's may experience significant mood swings, including increased irritability, anxiety, depression, or apathy. Personality changes are common, with individuals becoming more suspicious, fearful, or easily upset. Research reference: according to the Journal of Alzheimer's Disease, mood changes and personality shifts, such as increased anxiety and depression, are often seen in the early stages of Alzheimer's disease, reflecting the neurochemical changes occurring in the brain. 9. Misplacing objects. People in the early stages of Alzheimer's may begin to misplace things and place them in unusual places. They may accuse others of stealing items as they are unable to retrace their steps or find their possessions. Research reference: a study published in Neurology found that misplacing objects and the inability to retrace steps are common signs of the cognitive decline seen in early Alzheimer's disease. 10. Changes in sleep patterns. Early Alzheimer's can also affect sleep patterns. Individuals may experience disrupted sleep, insomnia, or changes in circadian rhythms, leading to sleeping during the day and being awake at night. Research reference: a study published in JAMA Neurology showed that individuals with early Alzheimer's disease often experience changes in sleep patterns, which may be related to neurodegeneration in the brain's sleep-regulating centers. Conclusion: early detection of Alzheimer's disease is crucial for managing symptoms, delaying progression, and improving quality of life. Recognizing these signs in oneself or a loved one, especially in the context of subtle cognitive decline, can prompt early intervention. While these symptoms may overlap with other conditions or normal aging, a healthcare professional can conduct tests, e.g., neuroimaging, cognitive tests, to help determine whether Alzheimer's disease is present.